siguro mo mas maigi, one of these days we can visit the plant, no? And then we will really show to our viewing public how we follow the strict compliance of the PFAD requirements.
Yeah, sure.
And then, ma'am, is there a particular website that they can visit just in case they would like to know more about the products of the PMI?
Yeah, please open your website at mx3santon.com.
So once again, ma'am, pakiulitan niyo po dahil baka nakaligtaan. Once
It's
again, the
mx3santon.com.
And ito sa Davao, where do they get the supply? Kung sakali, kasi marami sa mga pasyente ko, they have a hard time looking for a drugstore where they can buy the MX3 capsules. Ano ba ang mga outlets niyan?
I primarily available at Rose Pharmacy outlets nationwide. Available Manila, Visayas, and Mindanao, Rose Pharmacy. And don't forget to ask the freebies. So sometimes we give freebies. If you buy one box of MX3 capsule, we give one bottle of jam, one box of MX3 soap. So sometimes we give MX3 tea. So that's a freebies for every purchase of one box.
How much naman yung one box, ma'am?
It's actually 1,008 per box, so it would come out about 60 pesos something per capsule. But you got about 25% of the freebies additional.
What is inspiring about your company, ma'am, is the giving back to the community of helping, especially the poor patients. No, I have experienced it personally nung lumapit kami sa inyo, yung mga pasyente namin na mention kanina, talagang di cannot afford, no, to buy MX3. So, and then yun na nga, but nakakatuwa dahil as of our first meeting, you committed also giving free supplies of MX3 to indigent patients. So, since yung Beautiful Heart Foundation is into giving free clinics and treating poor patients for free, no, if there is a need for our patients to have MX3, we are assured that the company will give a free supply to these patients. No, so that is very, as I've said, very inspiring. That's why we are trying to promote the product, not only because it is a good product, but because it is also helping poor people. No? And that is the essence of a Beautiful Heart. No? The company has a beautiful heart. Hendrik, this year into the radio, no? Ano ba ang mga future directions?
We are here to support MX3 to a radio show. We call the radio show Kalusugan at Kabuhayan. It's a 30-minute show over DXRR AM Radyo Rapido, 1:30 to 2 o'clock in the afternoon. And we hope that you can be our host for that particular program para po natin i-explain sa mga listeners ng Radyo Rapido yung magandang effects ng MX3 sa mga nakikinig.
No. Sa ngayon kasi, Rick, if you talk about what is yung mga talagang deadly disease, no, number one na siguro dyan yung mga heart disease, no, or sabi natin yung cancer, no, walang gamot. But studies have shown na the Santon has anti-neoplastic effect, no. Merong tinatawag na cytotoxic, pinapatay niya yung cancer cells, no. I'm sure si Ma'am Gina is very much aware of that, no, na yung effect ng Santon doon sa mga cancer cells. And this has been proven, especially nga, sabi ko kanina, yung batang 7-month-old na merong medulloblastoma, medyo nakakakita na. Initially, this child had already developed the early signs of blindness, no. At the same time, since merong tumor sa utak, no, yung absorption ng cerebrospinal fluid, medyo nababarahan, so lumalaki yung skull, what we call hydrocephalus. So kagabi, nag-text din yung nanay, na initially, when I measured the skull, was 22.5 centimeters. Sinukat ng nanay lately, kagabi siguro, kahapon, 22 na lang daw, in just 1 week, no? So those are very promising signs na talagang may effect ang Santon, no?
So pwede ba, Doc, imbitahan natin sa radio show natin yung mga pasyente natin?
Oh yeah, babalik sila, no? In fact, I was telling Father Ponpon na I wish I could see the patient again, no? In the next few days para makita ng audience yung before and after, no? Kasi napakita naman natin in our previous shows, no? Yung all these patients nakita na sa television. Ngayon, that was before we gave MX3 in addition to other medicines, no, yung dapat na ibigay. But what is very important to emphasize to our audience na in any approach to a medical illness, we should combine both the Western medicine at the same time our Eastern or our alternative medicine. No? Dahil hindi naman lahat ng sakit nasasagot talaga ng Western medicine, especially cancer, especially mga heart disease, no? Or sabihin natin diabetes. Walang cure halos. No? Yung mga binibigay for diabetes is pinapababa lang nila yung blood sugar. But without those drugs, tataas ulit. But what is good about Xanto, no? It has an anti-diabetic effect. At the same time, it corrects the problem, no? Yung kung saan sinisecrete yung insulin, no? Somehow meron effect doon, nako-correct niya yung islet cell, yung Langerhans cells, no? Yung nagpo-produce ng insulin. These things are already written in papers, no? Malamang hindi pa lang siguro sa Philippines we need more studies, no? That's why I'm telling Ma'am Mrs. Espejo that in the future maybe we can come up with a multi-center study where we will try the use of MX3 in diabetic patients, in cancer patients. Sa ngayon parang anecdotal pa lang, no? We are not saying that this is already parang scientifically proven dahil of course we have to follow yung requirements din ng medicine, no? That it has to be to reach a number of statistically significant numbers, no? Na para masabi talaga na talagang scientifically proven. So that's why siguro mo nakaka-encounter kayo sa hirap with the BFAT, palaging ang labeling is food supplement, no? Food supplement lang talaga. And the reason behind there is because para masabing medicine, it has to pass the statistical significance test. No? Pangalawa, it should be repeated. Pangatlo siguro, yung formulation should be exact. Ano bang formulation natin so far with MX3? How do we have special dosage for special diseases?
Actually, with the cancer patient, it should have a higher dosage than let's say diabetes. So it depends on the stage of cancer. First stage, second stage, sa fourth stage. So it needs a higher dose.
Yeah, like yung sinabi ko sa inyo na parang may cancer in the neck area. I started her with 2 capsules like every 4 hours, no? So in other words, nakaka-consume siya at least mga 10 in a day. So maybe that's a good start for cancer patients. Now, for diabetic patients, maybe a good 6 capsules a day. It depends on the level also of the blood sugar. Pero yun nga, i-emphasize natin sa audience natin that do not stop, no, abruptly, yung bigla ang itigil yung kanilang mga gamot sa diabetics, yung pampababa ng blood sugar. For the meantime, they have to maintain that. And ganun din sa mga blood pressure pills, huwag nilang itigil bigla, no. Your doctor should know better kung kailan iti-taper yung dose. No? By the time na medyo mababa na, pwede nang i-shift into pure alternative medicine like MX3. No? Because medyo it takes a while before ma-repair yung pancreas in the case of diabetes. Or let's say, sa blood pressure naman, yung mga high blood, no? It takes a while before ma-normalize yung blood pressure. So it's not advisable for patients to abruptly stop the prescribed medicines for their illness. No? It might be good to think of it as a supplement for now, no? Para food supplement. Pero later on, I'm very sure, without those prescribed medicines, with MX3 alone, no? On the right time, on the right dosage, pwedeng yun na lang. But that should not happen right away. No? You have to consult your doctor, you have to tell your doctor that you are trying alternative medicine, and your doctor should know better when to stop the mainstream prescribed medicine. Ngayon, Rick, ulitin natin yung talk show, no?
Yes, sir.
So it is a 30-minute talk show.
Yes, over DXRR Radyo Rapido, 1:30 to 2.
Paano ba yung ating audience magkaroon ng participation dyan sa radio?
Actually, they can call the station, pwede sila tumawag, tapos they describe a particular sickness, and then, pag si Dr. Melendez will give his advice to the callers, or meron din tayong iimbitahan na listener na talagang pupunta sa radio station natin, Doc, para magtatanong kung anong dapat sa kanyang sakit.
Ngayon, because of the advent of this information technology, internet, do we anticipate that our audience can also send their questions through email?
Pwede rin natin gawin yan sa program natin, Doc.
Yeah,
Pwede natin.
or they can just phone in questions. No?
Yeah, pwede rin.
So, abangan nyo po yung darating na radio program.
Kabuhayan, kalusugan at kabuhayan.
Anong